All right. Good afternoon, everyone. This is Elshaday Belay, orthopedic surgeon and hip and knee reconstruction specialist with Ortho Virginia here in the northern region at Fair Oaks office. It's a pleasure to be here with you, everyone. We'll get into our talk today, really understanding hip pain and what are the causes and treatments for this. A little bit more about myself. I grew up in Houston, Texas, actually, and my family relocated since to the DMV area. Did my training in medical school and orthopedic surgery residency at Duke University. And I did fellowship training in hip and knee reconstruction at HSS, Hospital for Special Surgery in New York. So your hip joint is involved in almost every activity you do. And a diseased or injured hip can limit your ability to move and work, and these types of injuries can affect millions of Americans in the United States. So today, really understanding the hip anatomy, we'll talk through common hip conditions, hip pain, and treatment options for those specific injuries, and then ultimately when to consider surgery, and then we'll leave time for a question and answer. So the anatomy of the hip can start first with the bones around the hip. You have your pelvis, the acetabulum or the socket, the femoral head, which is the ball, it's a ball and socket joint, and the femur, the thigh bone. As an example, you can see what happens when you compare a normal hip to an arthritic hip. You'll lose the cartilage, you start to develop bone spurs and bone cysts, and you actually become a little bit shorter. And arthritis is one of the most common conditions that I see, and it's one of the most common causes of disability in adults. So ultimately, then this anatomy can correlate to why you have pain. So why does my hip hurt? Is it potentially related to the nerves or your spine, referring pain to your hip? Do you have hip impingement due to an injury to your labrum? Do you have arthritis with injuries to your cartilage? Or do you have bursitis, which affect the outer portion of your hip? And ultimately, don't forget about muscle. So these are also the most common muscles that I see as injuries around the hip. Your piriformis, gluteus muscle, your hip flexors, and your psoas muscle, another hip flexor. And what are the common causes of the hip pain? So one we touched on earlier, osteoarthritis, is a symptom, it's a process that starts with one or more joints, typically starts later in life, sometimes 50 years old and older. Sometimes it can start younger as well, but it'll affect all the joints in the hands, may affect one or both sides of a hip joint or a knee joint. Treatment can involve non-surgical treatment to reduce the pain and inflammation. And you can ultimately then get surgical treatment to remove the osteoarthritis. Other examples are rheumatoid arthritis, which is an inflammatory arthritis, where the body's immune system will actually attack the hip joint. This can result in an inflamed or swollen joint. It affects multiple joints, including your hands, and it typically starts earlier in life. So I see younger patients with this condition. You'll have loss of the hip space, the joint space, and interestingly, in the last 10 years, patients have actually needed less surgery over time because the medical treatment has been so good. Ultimately, though, if the medical treatment does not work, surgery is then a last resort. Post-traumatic arthritis, where somebody has had a broken bone or an injury around their hip, they have that injury fixed, then later they can develop arthritis after that injury. This is another common condition that results in somebody who may need a surgery for their hip. Another hip condition that I commonly see is called femoral acetabular impingement, or FAI. This is something that's less known, but is very common in the United States. This can result in hip pain that's developed slowly over the past few months. The hip hurts when you're bending, lifting, or sitting. You play or you're very active. Your x-rays otherwise are normal. You don't have arthritis. You may need an MRI to check for labral injuries or injuries to the cartilage. This is an example of such an injury, where you can see with the black arrows, there are bone spurs that have developed. That's called a cam deformity, a bump on the ball, the femoral head. And then this causes a labral injury over time. And so that's where the red arrow is pointing to. This patient has a labral tear. This is a different type of hip injury that needs a specific type of procedure ultimately if non-surgical treatment fails to improve. So these therapies can involve range of motion exercises to reduce impingement and ultimately may need surgery if they do not help. Muscle and tendon injuries. So this is often after an acute injury, a fall, or after exercise. You have pain typically over a specific area that muscle may be really soft or really painful to touch. You may notice cramping or spasms or tightness around the muscle. Your x-rays will typically be negative for a fracture, meaning a broken bone, no broken bones. There won't be arthritis. And you may need an ultrasound or an MRI to find the specific muscle that's been injured so that we can guide treatment for that muscle. Typically, the basics help with these muscle injuries. So rest, ice, compression, and elevation, RICE treatment. Then you may ultimately need some physical therapy to return that muscle back to normal function so you can get back to your activity or sports. There's also nerve compression injuries. So if you have a back condition like lumbar arthritis or nerve impingement, sciatica, these conditions, they can refer pain to the hip. So I'll see patients who come with hip pain, but the type of pain is different than, say, arthritis. Nerve compression pain typically results in shooting or radiating pain. You may experience burning or numbness or tingling, and is often worse when you're standing or just sitting, and it may improve actually as you walk. These features on the x-rays that we get, you typically may find arthritis in the back. The hip arthritis, there is no hip arthritis typically. The x-rays around the hip are negative or normal. There may be an MRI that checks to see if there's impingement on the nerves in the lower back. So an MRI of a lumbar back may be obtained to check for stenosis or disc herniations that are causing referred hip pain from a spine condition. And ultimately, medications can reduce inflammation of the nerves that are irritated. And ultimately, therapy can also help increase mobility and strength of the back and hip to reduce that inflammation. So what are some of these non-surgical treatment options for hip conditions? I'm sure some of you know these, and if you may have tried some yourself. Walking aids, canes, walkers, helps you put pressure away from the affected joint, takes pressure off of the injured side, and can help during a recovery. Heat or cold therapy. Often I recommend after an acute muscle injury, for example, I recommend cold therapy first. After cold therapy, in the subsequent days, muscle responds well to heat, so it will loosen up and be less likely to spasm. Physical therapy can improve your posture, can improve your hip mobility, can improve your range of motion. This is important so you don't become stiff. A stiffness is often a side effect or a sequela or a consequence of injuries. So we want to make sure you avoid stiffness as well. Medications. So anti-inflammatory medications, steroid medications, and potentially injections may also help with a specific hip condition. The most common conditions that an injection may help are things like bursitis, hip arthritis, and potentially nerve impingement. Then next, what are surgical treatment options when the non-surgical treatments aren't working? So arthroscopy is a common surgical treatment for these hip conditions. Most common for tendon injuries, labral injuries, or impingement, what we talked about, FAI. You want to ask yourself, though, is there significant cartilage damage or arthritis in the hip joint? If that is the case, it may not be the best thing to get an arthroscopic surgery because you may then later ultimately still need a hip replacement. It's important to evaluate the cartilage, important to evaluate the structure of the bone and the injury that you have in determining the right procedure for you. And ultimately, what activities do you want to get back to? If you're a young patient and you want to get back to sports, high-level activity, then an arthroscopy may be better suited for you for your injury. When to consider joint replacement. So hip replacement is a very reliable and durable operation. Most patients never need a second surgery after that. Ultimately, you want to ask yourself, is that joint pain, hip pain, affecting your ability to get a good night's sleep? Have you had to give up activities because of your hip pain? Are you constantly taking more medications because of your hip pain? And is that hip pain affecting your ability to do simple things like walking upstairs, walking on uneven ground, or even short distances? Then focusing specifically on the hip replacement surgery, I want to give you an example of what this looks like. So again, thinking back to our anatomy, you can see the pelvis, the hip, the femur. The surgery itself involves removing the injured portion of the hip. So we remove the arthritic socket, the arthritic ball, the femoral head. We then replace it with prosthetic implants that are made out of typically titanium. They're porous coated, meaning they have a surface where your bone can actually grow onto it. So you can see here the liner, which is a white material, very smooth, and the ceramic head, the pink ball. Those two work together to move around just like your normal hip joint would. And we put in a stem in the bone which also provides a structural support for the bone to support it and allow the hip to move naturally. Now, the unique way that I do my procedures is that I use a robotic assisted tool for hip replacement surgery. In my opinion, and there is evidence to support this, it allows for better accuracy, it reduces hip instability or dislocation, and it has good short-term patient-reported outcomes, and it has a very high forgotten joint score, which means that a year or two beyond surgery, patients can actually hardly tell the difference of which hip has been replaced after surgery. And this is a routine example of what that looks like. You can see on the right-hand side, this patient has multiple bone spurs, which are these areas. Okay, there are bone spurs, there's loss of joint space. The patient has had hip pain for many, many years. This patient has tried injections, medications, therapy, and all of this has really not helped with the pain and inflammation around the hip joint. And so we did a robotic assisted hip replacement. You can see this patient has a new socket, a new ball, and a stem that goes into the bone. Over the first 4 weeks, that bone will grow onto the implant to bind and become solid. After the 4th week, that patient is off of their cane and walking regularly and ultimately very happy with their outcome. And that goes the extent of the PowerPoint slides. And I want to thank you for again joining us today. And I'll leave plenty of time for questions and answers, and we'll talk through more hip conditions.
Thank you so much, Dr. Belay. We really appreciate all of those details. So one of our questions is, are there upper or lower age limits on hip replacement?
Excellent question, and one that I've really come across frequently. So we used to think that 20, 30 years ago that if you were a young patient, below the age 50, 40 even, that a hip replacement surgery would not be a good option for you because you would definitely need a second surgery. What we've now found is that hip replacements done in the modern time, in the last 2 decades, the materials that have been used are lasting much, much longer. Part of that is because the implant that we use, your bone will actually grow onto it. So after a certain number of weeks, it is solid. So now, as we've tracked hip replacements done in the United States, the United Kingdom, and Australia, we found that hip replacements at 30 years are doing essentially about 90% success rates, i.e. patients who've not had any procedures after that time. So really 5% of patients may have a risk of having a second surgery after 30 plus years potentially. We think that's because the materials have become better. And in my opinion, again, the way that surgery is done, I also think that making sure you do the surgery correctly is important. So we pay really, really close attention to the anatomy and restoring the patient's anatomy. And we think that a well-done hip replacement can last most patients' lifetime.
Thank you. You spoke about a bunch of different reasons why someone might have hip pain, but how can you tell which one of them is the cause of the hip pain? How do you, as a doctor, distinguish between those?
Yeah, so my assessment in the office always starts with a really simple question, is where does it hurt? And most patients will say, my hip. And then I'll go further and I'll really ask some specific questions. When does it hurt? Where specifically around the hip do you feel that the center point of that pain is? Is it in the very front? Is it on the side? Is it in the back? Does it go from one and spread to the other? And so these types of questions really hone in on what are those potential causes of hip pain that we talked about. So for example, nerve pain causing hip pain. When I see someone that has nerve pain, often the pain will not be in the back. It will not be in the lower back, but it may present around the hip. But there'll often be pain that starts in the back of the hip, where your back pocket would be, so to speak. And it may shoot or radiate, go around the side of the hip and go down the leg. It may not go down to the foot, but it may go down the leg. So those types of questions and answers really help me focus in on what potential causes of the hip pain we should look further into. So based on those answers, we get x-rays, we may get ultrasound, we may get an MRI. And these investigation studies then lead us further down in diagnosing correctly what the problem is so that we can give you the correct treatment plan.
Thank you. Can a cortisone shot make hip pain worse long term?
Very good and controversial question. So cortisone has been safe and used around the body for several years. It's a very safe and good alternative for both a diagnostic and a therapeutic treatment plan. I recommend against an unlimited number of cortisone injections in the hip. The Academy of Orthopedic Surgeons looked at the success rate of injections into the hip. And unlike the knee, where we do injections, and you can do injections for several years safely, the hip has had mixed results. For some reason, hip joints may become sensitive to long-term injections and may weaken the bone quality of the hip. So we are very cautious about the number of injections that we give in the hip. And typically, I don't recommend more than 2 in a given 12-month period. And if that second injection does not give that patient at least 75 to 80% relief of symptoms for greater than 3 months, I would not recommend further injections. So we've become very cautious with the amount of hip injections that we recommend.
Thank you. Is subchondroplasty effective in the hip?
So subchondroplasty is a very specific procedure, and really for a specific problem. So subchondroplasty for the diagnosis of an osteophyte or arthritis has not been shown to be effective. For a general condition, for a cartilage injury, if there's a cartilage injury, there have been different techniques. Subchondroplasty, achondroplasty, microfracture, cartilage regeneration replacement. None of these procedures have shown to be very effective, greater than 5 to 10 years out from those procedures. So I don't recommend those procedures lightly. It's really a very specific injury and very specific diagnosis that would be a good candidate for that type of procedure.
Thank you. How soon after hip surgery can you walk upstairs?
Yeah, excellent. So after hip replacement surgery, my patients are able to walk up the stairs the day of surgery. So we have you work with a therapist, and you're able to take slow single steps at a time, but you're able to go up those stairs right away. There are no restrictions as to the number of stairs that you do. It's slow, as you would anticipate, but you're able to walk up those stairs. Different surgeries, for example, if you've broken your hip or you have a chondroplasty or a different type of surgery around the hip, it may be different if you're not allowed to put full weight down on your leg. But after hip replacement, you're able to immediately walk upstairs.
Thank you. What is bursitis and how does it interact with arthritis in the hip?
Really good question. So bursitis, it's actually a soft tissue problem. The bursa of the hip, there are many. The most common is around the greater trochanter, which I'll show you on this model that I have here, is around the side of the hip. The trochanteric bursa is a sac that protects the abductor tendons that attach onto this bone. And they can become irritated with repetitive activity, walking, stairs, and just life. And the worse arthritis becomes, typically those patients may start to experience worsening bursitis because the same problem is causing both to get worse. It's not that the arthritis is causing necessarily the bursitis or vice versa. They're typically 2 separate entities, but they are often very commonly existing together.
Thank you. After a total hip replacement, are there restrictions on how you can sit, how long you can sit, or what you can sit on?
Good question. There are differences between different surgeons and the different ways that patients have surgeries, whether it's a first-time surgery, a revision surgery, an anterior surgery, so the approach of the surgery, if it's from the front or from the back. Generally speaking, for most hip replacement surgeries done in the United States, there are no restrictions on how long you can sit or what you can sit on. Most patients feel comfortable in an about 90-degree position or in an elevated position. And restrictions are specific to the type of surgery you have. So some patients who have a posterior surgery from the back may be on specific types of precautions for a short number of weeks. Patients who have anterior surgery may be on different types of precautions for a different number of weeks. So it depends on the type of surgery and the surgeon's recovery protocols.
Thank you. How can you tell the difference between osteoarthritis and inflammatory arthritis in the hips? And does one cause or exacerbate the other one?
Really good question. So osteoarthritis and inflammatory arthritis are typically two different entities. They rarely, almost never exist at the exact same time in causing joint problems. So a specific type of diagnosis has to be made for inflammatory arthritis. It typically requires blood work to check for inflammatory markers to confirm diagnosis of things like rheumatoid arthritis or psoriatic arthritis, different types of causes of arthritis. And so they don't necessarily make each other worse, but they are often the nomenclature, the name is interchanged, but it's really a specific diagnosis when somebody has inflammatory arthritis. So you should get an accurate diagnosis, whether it's your orthopedic surgeon and your rheumatologist or your primary care doctor that work together to come up with a diagnosis. An accurate diagnosis can help better treat that problem. So if you have inflammatory arthritis, you have to be on specific medications, or you may benefit from specific medications to prevent surgery altogether, whereas osteoarthritis doesn't respond to those types of medications.
Thank you. Does pain in the hip at night but not during the day mean something specific or indicate a specific diagnosis?
Yeah, so again, it depends on the questions and answers that follow after that. It's a very important point to note when the pain occurs. So the pain at night is important. That's an important history component. But then the subsequent questions would look into, do you have pain that's worse with sitting or walking or laying flat at night? These types of questions, the position of the hip and when it hurts is equally important. So it doesn't necessarily mean you have a specific diagnosis if the pain is only at night, but it depends then what are the next questions that we ask and what are the answers and further investigation before we find the answer.
Thank you. What is the recovery time after a hip replacement?
Yeah. So hip replacement is quite predictable. Most patients in the first 2 weeks are mostly staying around the house. You're able to take care of yourself with the assistance of, maybe a family member or friend. You have a walker or a cane. Some patients are able to get off of the cane within the first 2 weeks. Not everyone. By 6 weeks, most patients are able to be off of the assistive device that they were previously on. Now, if you always used a walker or always used a cane, you may still be using that at that time. But most patients are around six to 8 weeks able to get off of those devices. And so you're able to take care of yourself. You're able to drive. You're able to do simple things like go to the grocery store. Going back to work and activities depends on the activity and work type that you do. So if you have a sitting job or a desk job, you're able to go back to that sooner than, say, going out and working on your feet or lifting or carrying heavy objects.
Thank you. What are some exercises to help relieve hip pain, or where can patients find out that information?
Absolutely. So one great place is actually the Academy. So AAOS, AAOS, has a great section for patients to look up conditions, hip problems, and exercises, general hip conditioning exercises for patients to work on their own. We also have great Ortho Virginia therapists that can see you, evaluate you, and give you recommendations on exercises and techniques to relieve your hip problems. And some simple things that you can do are staying active. So going to the gym, walking, getting into a pool, or riding a bicycle, working on your hip, but also your back and your core. These types of exercises can keep your whole pelvis and hip strong.
Thank you. Is a hospital bed necessary after a hip replacement?
No, not typically. Again, everybody is different, and so there are different circumstances for every patient. We have to factor that in. But typically, most patients are able to sleep in their own bed.
Thank you. Is taking long walks good for the hip, even if the hip is hurting some with the walks?
So walking is an excellent way to stay active, stay healthy. You should listen to your body. You should certainly don't want to walk farther than you're able to safely. So if the hip pain is constantly getting worse, the further you walk, you should shorten your walk slightly. Maybe incorporate other activities that allow you exercise but not aggravate your hip pain. So I wouldn't necessarily say to walk more if you're still hurting, but maybe change the type of activities you're doing to stay active but not cause hip pain.
Thank you. Is there a risk in waiting too long to get a hip replacement?
So it's a really interesting and good question. There's no time limit, so to speak, with hip replacement surgery. The biggest thing that I see is that patients who have had years of non-surgical treatment, and the non-surgical treatment, things like medications, injections, aren't working, but they're still doing those things. And ultimately, they get to a point when maybe they aren't as active or as fit, and medically, they're not safe to have surgery at a later time. So those are the things to consider, is to really incorporate, your medical conditions, your home situation, and are the non-surgical treatments working? If they are working, then there's no rush to hip replacement. But if they aren't working, and if you're otherwise healthy, it's important to consider, better long-term solutions.
Thank you. Does bone-on-bone arthritis in the knee affect the hip and cause pain?
So yes, in two ways. One is that severe arthritis in one or other joints can change the way you walk. So you may be putting more pressure or more weight on a hip joint or the other knee joint. So that's one component of this. The other aspect is that if you have bone-on-bone arthritis in a knee, there is a chance that you may have a similar problem in the affected hip. So the other side or the same side hip may also be experiencing arthritis due to genetics or injuries or just time as well. So there are two ways that can have an impact.
Thank you. And our final question is, can you repeat which Ortho Virginia office you are in?
No problem. I'm in the Fair Oaks Clinic in Northern Virginia, and we'll soon eventually be in the Fairfax office as well.
Thank you so much, Dr. Belay. That is all the time that we have for questions today. Dr. Belay, would you like to close?
Again, thank you everyone for joining us on this afternoon. Enjoy the rest of the week and have a happy 4th.